So
Meeting is being recorded.
so typically if you go to a dentist and everything was so fine and then you go and then there's a bunch of stuff that comes up, I highly recommend you get a second opinion. Just because I've seen so many dentists treatment plan so differently, and they've even done studies where they show dentists the same x-ray on different days and they see different things. So unfortunately, that's the diagnostics that most of us dentists are working with. We're working with just plain old 2D x-rays, and so getting a second opinion would be good. The other thing is if there actually is decay, usually there's a huge connection between gut health and health of the mouth. So a lot of times we see if the microbiome in the gut is off, then the microbiome in the mouth is going to be off too. So in our office, we actually do a cavity test where we're testing the microbiome so we can see, is this a bacterial issue, right? You have to have cavity bacteria in your mouth usually to make cavities. But a really acidic mouth can also be a risk factor for cavities as well. So we have to kind of figure out what are your risk factors? What do you present with today, right? If you have really acidic saliva today and your microbes are off the chart, then we have to come up with a plan to balance out that microbiome, and we have to come up with a plan to reduce that acid. The bad bacteria make the acid, so it's kind of this positive feedback loop. So usually when someone has cavities, it's like, all right, what's going on in the gut and acidity wise in the mouth. Changes to medications can cause dry mouth. That can cause increased risk of cavities. You've got to look at, diet. Did you start doing something weird? Some people like they started drinking lemon juice in their water, or like those little things that you might not think make a big difference can sometimes be really profound. The other thing that can really affect cavities, and I've seen this actually too much, but stress. Stress is huge. I had a patient once that had no cavities, like she was probably, I think she's in her 60s, 50s, 60s, no cavities. And then her sister got diagnosed with breast cancer, and she was her caretaker, and it was so stressful for her. And she ended up basically coming in, and almost every tooth that she had in her head had a cavity on it. So we've got to look at kind of all of those things comprehensively and kind of go back and figure out what's going on. But I would definitely start with a second opinion first. And if you do have some demineralization and there's smaller cavity areas, we have the capability to remineralize those. So you don't have to do a lot of dentists, like they don't know about peptides and they don't know about remineralization treatments. So they'll say, oh, you need drill and fill fillings. Well, once you drill in a tooth, number one, you've just reduced the strength of that tooth by 65%. And secondly, once you put a filling in a tooth, you're married to the dentist. So you are going to need to have that filling replaced over time. I don't care how good the dentist is, the bonding over time is going to fail. So fillings last on average, studies show about 7 to 10 years. So if we don't have to drill, I don't want to drill. I want to start with remineralizing. So a lot of these times, like I said, I see these treatment plans from dentists that have these huge treatment plans and there's 10 cavities. And a lot of the times we can remineralize those areas and not have to drill at all.
How do
Of
I do
course, if
that?
they're bigger, we can't do that, right? But so there's limitations. So every tooth we have to look at every tooth individually.
How do I do that?
Yeah.
How do I do the remineralization? Because I am using one of
Oh,
those toothpastes that has the nano hydroxy.
yes, so that will help. But the treatment I'm talking about is actually a treatment. It's a peptide. So you have to come into the dental office and then we will treat the tooth with, we clean it. We treat the tooth with ozone, which sterilizes it. And then we place a peptide. And that peptide has to sit on the tooth for 5 minutes. And then, and you can't drink or eat anything for 30 minutes after that appointment. And basically what it does is it recruits the mineral from your own saliva, your good toothpaste, all of that to come in and rebuild. And then what we do is we take an x-ray 6 months after and we see, did this heal? We can actually see it on an x-ray if the lesion healed. And sometimes if that lesion didn't fully heal, we might do another peptide treatment on it. But we obviously, they're pretty successful. I mean, the success rate in those, if you treat the right size lesion, you got about a 95, 96% chance of remineralizing a tooth and not having to drill. So it's pretty
because
awesome.
because of the fillings of the cavities. I think there was only one where it was a previous filling that had come out. I think the others were all new, and there were a whole bunch of them.
Yeah, yeah. So I would
Correct?
just, the question is what's going on systemically in your body? Why is your body doing this? And most of the time the answer lies in the gut, your gut health. And if
Okay.
you have, if you have any dysbiosis in the gut, that can cause even silent acid reflux. And the other thing that we look at too is nutrition. But again, if you haven't had this your whole life and then all of a sudden and you've been eating the same way, it's probably more of a gut issue that maybe is starting to rear its ugly head because our microbiomes are constantly changing.
Yeah. So something obviously is different. And of course I've had cavities and of course I've had fillings and stuff, but I, to have a whole bunch of them all at once is concerning.
Yeah,
Yeah, I get a
I
second opinion.
I had a patient that she changed her diet and she started eating a lot more tomatoes, so more acidic things. Within 6 months, she had a huge change and she had a lot of teeth that had cavities. So, as Dr. Taylor says, the pH in your mouth is a big part of it. Of course, the microbiome, the type of bacteria, the acidity, what you're eating, sparkling water. A lot of people do that and start sipping throughout the day, and that is acidic even if it doesn't have any flavor. So if you had changed something within this time, maybe that's something to look into.
And
Yeah.
even things like taking vitamin D, like if you take too much vitamin D and you don't take vitamin K2, then it's not, you're going to have issues with absorbing mineral. So this is where, like, in our office, we spend a lot of time with patients really trying to dig and figure out why is this happening, right? Because it's not always the same reason for everybody. It's not, there's no like, oh, well, this is happening because definitely this, right? So we have to kind of go back and we have to ask about diet and nutrition and supplements and medications and your history and, all of those things. And then the other thing that can also happen is, if you're sleeping with your mouth open at all, that's going to create more acidity too. So as we get older, our muscles get weaker in our airway, and all of our muscles in our whole body get weaker. And it includes our lips and our airway muscles, right? So if we're sleeping with our mouth just hanging open a little bit, that's going to dry the mouth out and cause more acidity. So there
Mm.
are so many risk factors when it comes to cavities. We really have to kind of go down the list and really rule them all out. Um, and my guess, I mean, I don't know what your x-rays look like, but if you haven't had them and all of a sudden you have some spots, hopefully they're smaller and hopefully you can remineralize them with a peptide treatment and not need to drill because as you said before, those fillings over time they fail and have to be replaced. So I wouldn't look too much into that one but the new spots would be concerning to me.
Okay. So I should at least see if I can get the remineralization through um, one of your dentists.
Yeah,
That would
yeah,
be
that would
great.
be good. I mean, the first thing is we have to make sure that we actually agree with the diagnosis, right? Like I said, a lot of times people come in and they're like, they said that I have 12 cavities and I'm squinting at the x-rays and I'm like, I just don't see it. Like maybe if I shut one eye and I blink really fast, like maybe I can kind of see something, but I just think the first step is really to figure out, do you actually have cavities? Do we agree with that diagnosis? And then we can decide if those areas are a problem. Are you a candidate for the peptide treatment?
Well, it took both your hygienist and one of your dentists. They both agreed. So, I mean, in terms of the cavities.
Okay, well, if you've already been in and that's already been established, then yeah, the next step would be to come in and treat those. You want to treat them before they get bigger. Cavities
That's
don't
right.
get, they usually don't get big just like overnight, right? You have a little bit of time, but again, like with anything, it's so much easier to treat when it's small.
When, oh,
Yeah, yeah. And it's so much minimally. I mean, you don't have to get numb for the peptide treatment. You don't have to have any drilling done in your mouth. Like you don't have to come in anxious. Like it's just like a very easy procedure to do. In fact, the hygienist does that remineralizing procedure. So it
oh,
doesn't even have to be done by a dentist.
oh, okay. Except
Yeah.
Barbara is so busy that it's hard to get an appointment with her.
I know. So we just hired a new hygienist, actually, Wendy, and she's fabulous. She's been getting rave reviews, and Vana and Barbara have both worked with her and trained her, and she's there full time. So it's really helped open up our hygiene schedule. And to be honest, like a peptide treatment like that, it's so easy. You could see anybody for that. I wouldn't hold out for Barbara's schedule. You can see any of our hygienists to get that done.
And can I get a bunch of the cavities done at once or in one treatment, or does it
Yes.
have to?
Yeah. Yeah, we
So
like to just paint them. Yep, we like to paint it on all the teeth and just let you sit for 5 minutes. So, yeah, most of the time we're doing multiple uh, peptide treatments. It takes
oh,
about 5 minutes per tooth to do it, but we can do multiple teeth at a time. So it's pretty fast.
But something to understand is if you have existing, for example, restorations, this treatment doesn't work for you. If you have crowns, this treatment doesn't work for you. It only works with small lesions, small cavities, incipient, something that is just starting. So if you have restorations that are existing or if you have crowns, it's not going to work. So then maybe doing something what Dr. Taylor was telling you is like, okay, let's find out if there is something going on in the microbiome, something in your gut that is causing all these changes. But we can look at it case by case and then give you a little bit more information. It's easier that way. But
Mhm.
there are options for sure.
well, certainly any of the teeth where it where the tooth itself is basically okay apart from the cavities, then it would be good to do the peptides.
If it's a candidate,
Yeah.
as Dr. Taylor said, yes.
Mhm.
If it's a small lesion, if it's under, if it's old dentistry that needs to be replaced, you can't do the peptide treatment because we have to take the old dentistry off.
Mhm.
But if it's a new tooth and it has a small lesion on it, then the peptide treatment can be really helpful. But again, we have to make sure that you are a candidate for it. So if you've already been in and you've already seen our hygienist and you've already had a treatment plan, you should see on there what teeth, if there's any teeth that classify as okay to have the peptide treatment, it should be obvious on your treatment plan. And if you have questions about it, we're happy to do like a follow-up consult. We usually don't like to talk about patients because these are recorded and
Of course.
there's, hip stuff. So we're not going to pull up your chart and go over everything and share it with the world. But if you want to just do if you're not sure about things, we're happy to do a quick consult and go over your treatment plan.
Well, yeah, I would certainly want to see if there's a possibility of doing the peptides on at least some of the fillings, cavities.
Yeah.
Mhm. Does anybody else has another question? Um, maybe.
I have a question.
Mhm.
I have an very old root canal. It's not giving me any trouble, but I know it will one day. And so that's why I was so glad to find you guys, because I would rather go to a holistic dentist than a regular one for something like that, because I don't want to get another root canal. Is that something you'd be able to help me with?
So do you have a root canal already, you said?
I do. It's a really old one.
Okay. And then you want, so we don't do root canals at the office.
No, that's why I'm so glad to find you, because I don't want to do that again. So I'm just expecting it to flare up one day because it's very old.
Mhm.
Then I would want to know that I could come to you folks and you would know what to do. So I don't want another root canal.
Yeah. I mean, typically so if you have a root canal, um, your tooth is not alive anymore.
Right.
So just having a root canal means that they take out the nerve of the tooth and they clean it out and then they put a filling material in the tooth. And the problem with those root canals is that you can't seal a tooth 100%, right? A tooth, it's very spongy. There's tubes inside, bacteria fill in there.
Mhm.
And so even if you go to the best orthodontist and they use all the fancy equipment, and I learned this in dental school, you cannot sterilize a root canal tooth. And so you've now created this environment that is dark and warm, and there's no immune system, right? Because they took out all of the blood and all
Yep.
of the vitality of that tooth. And so there's a controversy about root canals, and whether they really are serving our systemic health, because they're basically these pockets in our body where infection and bacteria can hide, but the immune system can't get there to fight it off, right? So in a biological practice, typically, you've got two options. If a tooth needs a root canal, you can either have a root canal or you can have the tooth extracted. But basically, a tooth is it's a dead organ, right? I mean, literally we open these teeth up, they should be bleeding inside, there should be blood, and we see gray tissue, which means that it's dead and necrotic. So if you have a root canal already and it starts to act up, this is really common because again, you cannot sterilize a root canal tooth, right? So over time, you're going to have bacteria that just continue to multiply. And then you're eventually, you don't really feel it because there's no nerve inside that tooth anymore, but eventually you can get some pretty big infections around these root canal teeth.
Yeah.
Take a CT scan and it's amazing how many of these root canal teeth, people don't feel them. They don't feel these infections because there's no nerve, but they have these big, big abscesses around them. So in that case, that we really would recommend extracting. Now, if you go to an endodontist, they might be willing to retreat the tooth. They will take the old root canal out and they'll retreat it. But in a biological world, and if we're looking at it more from a holistic mindset, typically the holistic world is going to be more in favor of removing an infected root canal tooth instead of a retreatment. But we
And
always
do you do that there?
we do, yeah. Dr. Isabel actually does it in our office, and she's fabulous. And we use ozone and we use laser, and she spends a lot of time removing the infection, which is really the most important part. When I went to dental school, they taught us, oh, you just pull the tooth out and have them bite on gauze. But the problem is that if there's infection left inside of that bone is not going to heal very well. So yeah, Dr. Isabel has a fabulous technique. And actually, we have a podcast called Your Mouth Matters, and we did an episode where we talk all about, her surgical technique and the technology that she uses. So I would recommend you go check it out if you want to learn more about that. Yeah.
Yeah. Thank you.
You're welcome.
So if we don't have a question, I guess there is a question from a patient or yeah, someone sent them question saying that they have a 15-month-old daughter that has developed early cavities. It seems that the only affected tooth so far is the front tooth. The mom has been cleaning her teeth with a soft cloth and started using Biocidin and hydroxyapatite toothpaste after noticing some white spots. Her question is, from a biological dentist perspective, what can I add? What can I do? And should I do what they recommend, the silver diamine fluoride, or drill and fill?
You want me to take this one or you want to take this one?
Sure, yeah, you can go for it.
Okay, so in a 15-month-old, a cavity, I mean, really in any age, it's not normal. It's super common, but not normal. So if a 15-month-old has a cavity, we have something majorly going on systemically that's off. And so the number one thing is that we have to really, like we said before, look at gut health. We have to look at diet, nutrition. Cavity bacteria are going to eat carbohydrates, and they eat carbohydrates, they poop out acid, okay? And that acid is what makes the cavity happen. So cavity bacteria are not able to take fat or protein and make a cavity. So in a kid like that, you want to look at the diet, super important. We want to prioritize good fats, good protein, and we want to limit our carbohydrate intake. There is no amount of carbohydrates that we need to live, which is crazy. So we want to really make sure that we're limiting that, especially when we're trying to put out the fire. Usually in a 15-month-old, we've either got something going on in the gut, we've got like a major dysbiosis, we may have a nutrient deficiency. So we want to also make sure that we're supplementing with things like cod liver oil, which are going to support good fat-soluble vitamins. Fat-soluble vitamins are going to allow the mineral to get put back into the teeth. So fat-soluble vitamins are vitamin A, D, and K2. So I really like for every kid, and even I think it's one of the best supplements for anybody to be on, but I really like cod liver oil. Cod liver oil has natural occurring vitamin A and vitamin D, so it helps the immune system, and it's going to help with remineralizing teeth. You also need to have K2, which comes from grass-fed butter. And so you want to make sure that you're really getting those good fats in your diet because that's going to help facilitate proper the proper absorption of the mineral into the teeth. Magnesium is also really important. And then, of course, the microbiome is also very, very important. And so there are different types of probiotic supplements that you can use. We usually recommend a spore-based probiotic so that it gets through the stomach acid and can get into the gut. Kids respond really quickly to diet changes and supplements. And if we can identify with a naturopath, maybe what is causing their sensitivity, maybe they have a gluten sensitivity or maybe they have a milk sensitivity. If we can identify what is causing the inflammation and what's causing these gut issues, then there's lots of cool treatments that kids can do, like LDA and LDI, that help kind of reprogram their immune system so that they're not as reactive. So in a 15-month-old, the first stop really should be the functional medicine doctor to really dive into nutrition, nutrients, diet. That's the first step. The second thing is a lot of kids that have front teeth cavities, if it's only on the front teeth, that can be a sign that they have a lip tie. So food is kind of getting stuck up there. It can also be a sign that they're mouth breathing. So at nighttime, their mouth is open. So put a camera in their room and go watch them when they sleep. Is their mouth open? Because if their mouth is open, it's going to dry out the teeth. The saliva is what protect and remineralize the teeth. So if your saliva is not bathing the teeth all night long, your teeth are more vulnerable to breakdown and cavities. So if your mouth is open, usually the front teeth are the ones that are affected and the back teeth are fine. Or they're more fine. So I would definitely look into that. If you identify that there is an open mouth posture, then we gotta see if the kid can even breathe through their nose or not. A lot of times kids can't breathe through their nose, and that's why they mouth breathe. And so doing nasal clearing in this age, which is where the water goes in one side and comes out the other, and you're clearing the nasal passages. Teaching nasal hygiene to a young baby is one of the most preventative things that you can do. And that's not just going to help with their cavity health, but it's also going to help with their facial growth and development. Because when you have a kid that's mouth breathing, the palate is going to collapse and there's not going to be room for the teeth to come in. And that also can cause a deviated nasal septum. So all of those things, when we're actively growing, we really want to be very aggressive and very preventative. And like I said, in that 15-month-old, we can do a lot of things that can really kind of get them back on track because they're still growing. In terms of the actual treatment, you can do the silver diamine fluoride. We don't love fluoride in our office. We do have silver diamine fluoride that we do occasionally. It's going to turn the tooth black, so you have to be aware of that. So sometimes it's really a cosmetic issue. Typically, a 15-month-old is not going to be old enough to where we're going to want to touch them and do fillings and dentistry, right? You also can do iodine treatment. So there is several dentists that will actually, instead of the silver diamine fluoride, do iodine on a Q-tip, and they'll just hold it on the tooth for as long as they can, basically. And they'll do that, and that also will stain the tooth, but that doesn't have the fluoride in it. Other things that we can do on a 15-month-old, like that peptide treatment I was talking about, is great, but for a 15-month-old, the cleaning agent before it goes on is pretty sour, and we're probably not going to get that 15-month-old to sit still for that long. Ozone gas is another one that we can use to remineralize teeth, but again, you can't breathe it in through the mouth, and it's got to be used safely. And then again, in a 15-month-old, especially if they're mouth breathing, that's going to be really challenging to do. So in that age, it's really hard because we're really limited with their compliance. So I would either try the iodine first, and you could even do that at home. And then there's another product instead of the silver diamine fluoride. It's called silver nitrate, and they use that and have seen similar results. I don't have as much experience working with that because we typically are not treating 15-month-old babies, but I have heard that some dentists are using that instead of the silver diamine fluoride. Again, it still stains it black, but you're getting a similar result. If you're going to do the fluoride treatment, you want to make sure that you supplement with some iodine and a binder, most likely to help with that fluoride because they're getting exposed to some fluoride.
Good. That was the only question I had.
Okay, perfect.
I don't know if there is any more questions from you guys, everybody that's here. Did you receive any other questions, Dr. Taylor?
I did not receive any other questions
Yeah.
that I see. Let's see. And if you want to submit your questions, you can put them in the chat box too.
Mm-hmm.
So I'm actually going to take off everybody and let Isabel finish up. She's amazing and really knowledgeable, and I feel like I've been hogging the mic. So I I'm gonna go, but I'll see you guys I'll see you next month if you decide to join us for our next webinar. And Laura, like I said, if you have questions about your treatment plan, reach out to us. We are happy to do a consult to go over like your plan and like specifically go over all of the things that you need and what we would recommend. So feel free to reach out to the front office to set that up if you want. Okay? All right.
Perfect.
Good night, everyone.
Bye, good night. Okay, as Dr. Taylor said, you can submit the questions in the chat, or you can just open your mic and just let us know. Before you decide to ask a question, or if you start typing, one of the things that we recommend when we talk about remineralization is to avoid high fructose or synthetic sugars. Definitely try to stay away from a lot of processed foods or added sugar, the sweet drinks, the juices. Well, we were talking about the sparkling water because the sparkling water is acidic. One of the things that I discovered recently is that my patient was drinking water with trace minerals, and she started developing some cavities. When I tested her water that she was sipping throughout the day, that water was at 6.5 acidity. We want to have more neutral pH, which is around 7. So every time she was drinking her water with the trace minerals, she was exposing her mouth to acidity. So that's important to know, especially if you're starting to notice that there's new cavities showing up. Another thing that is it's important to know is a lot of the times that food is advertised as low fat. We want to just try to stick with as natural as possible instead of having something that is advertised as low sugar, low fat. We want to also try to stay away from vegetable oil, soybean oil, canola oil, all these different oils that have industrialized omega-6. We just want to try to stay away from that. And then for kids, especially cereals or things that are baked goods, those stick to the teeth more. And even for adults, stick to the teeth more, and then we can have more cavities when we start ingesting more of that. So trying to minimize these processed foods and then stick more with protein, animal protein, it's really important, especially for healing. And if you're having surgery, for example, my patients where I do the surgery and we place zirconia implants, if I check my patient and the implant is stable, but then 2 weeks later I check the stability again and there is some mobility, the majority of the cases is the patient is either a vegetarian, vegan, and their consumption of animal protein is not high, or protein in general. So at least having some bone broth or something that can help stimulate the bone growth, that will be a really good idea. So organ meats, beef liver, if you cannot take it or you don't like it, there's supplements that you can have with beef liver. Fish, seafood, wild caught will be better, chicken, eggs, fruits and vegetables, being careful. A lot of the ketos, especially, they're really big in having fruits. And if you're eating fruits all day, you're exposing your teeth to the acidity. And the thing is that it is okay to have your fruits and to have these acidic things, but restricted on a smaller window of time instead of sipping it throughout the day or eating it multiple times a day. Because every time you expose your teeth, you're not allowing your body to go back to a more neutral pH, which is what we want. And what Dr. Taylor was saying is that the saliva is the one that has the minerals that are going to help us remineralize our tooth structure. So we want to just try to start kind of eating a little more animal protein, some fruits and vegetables, but the fruits, be careful if they're acidic, and the majority are, just eat it, sit down, eat it instead of biting here and then bite another one in a 30 minutes or in an hour, and then another one. So it's just more like a smaller window to consume those acidic foods. High fat, protein, or low carb diet is a good idea. One of the things that we recommend is Dr. Taylor mentioned vitamin D, but it's important to take it combined with K2. When you combine the K2 with the vitamin D, the K2 is like the driver, and it's going to drive that vitamin D into the bones, into the areas that we need it, and instead of just floating in the blood. Magnesium is important as well. We have at the office a concentrated K, and this is a really, really good one to start taking. You can take like 2 cups of that per day, and you can take your vitamin D depending on your levels. And those are things that are important to monitor. I have had patients that they told me, oh, I didn't take any of my vitamin D because it was summertime. And yes, we can transform the vitamin D when there is more sunshine, but unfortunately, not everybody, and I'm one of them, that doesn't transform the vitamin D. So we need the extra supplement. So you don't know if you're having good amount of vitamin D in your body unless you test yourself. And at the office, we can test in 10 minutes. We just poke your finger, we put it in a little device, and then we will be able to have results within 10 minutes. Or you can have your doctor test the vitamin D. So then you know exactly if you need to boost the vitamin D that you're taking. Normally, to maintain, you can take about 5,000, but also ask your functional medicine doctor or your primary care physician and see how you are and what it is that you need. So there is a question about, what do you think about taking xylitol? Xylitol is a really good idea for our teeth. There are some people that are susceptible to xylitol, and especially you don't want to be taking too much of xylitol because it can, in some cases, cause diarrhea. So just with everything, moderation. If you're using xylitol, there is a really good like spray that you can use, and you can put it in your mouth, especially if you're having some dry mouth or if you're having a higher risk of cavities. Is not a bad idea to have some xylitol, but don't overdo it. Just read the labels and see how much it is the recommended amount, because you can have some sensitivity. That's with the xylitol. Another important vitamin that we recommend and is critical for healing is vitamin C. Vitamin C, then we can have, as Dr. Taylor said, cod liver oil. So those are kind of important things that we need to help our body. Our body is so wise. Our body knows what to do, but we need to help it and provide the right environment to be able to do what it knows, which is healing. So what foods would you recommend babies with newly erupted teeth to avoid? Definitely sugary foods, anything that is too sticky, like carbohydrates, processed foods. Those things are really sticky. So then they just start increasing the amount of bacteria in the mouth that is going to be causing decay. So the acidic, I've heard fresh fruit can be too acidic, yes, but my 1-year-old keeps asking for it, especially berries. So it's great that your baby is asking for that. But as I mentioned, just be gentle with how much and how often are you giving the food. Like let's say let's have a snack and we're gonna snack this fruit, and then you finish it instead of, oh, let's just bite one piece here, and then 30 minutes later or an hour later you're going to have another piece, and then 2 hours later you're going to have another piece. So it's just not that you're restricting your kid from the fruits, is how you're providing the food and how often you're exposing the teeth to this without allowing the body to go back to a more neutral pH. So it's better. And same thing with your sparkling water. And that's what I do. I like my sparkling water, but then I just sit down, drink my water, and that's it. So I allow my body to go back to a more neutral pH instead of constantly exposing it to the more acidic pH. Okay. Is that clear for you, Maria? Or do you guys have any other questions? So if you have any questions, just remember you can send those to info@Green City Dental. And that way we can have it. If you're not going to be available to join us on the next month's meeting, we are recording this meeting so then you can watch them later. Any other questions? No, another thing that I just want to mention, because this happened to me yesterday with my patient, is that especially men somehow they don't like to go to the doctor. And my patient, with every patient, we take their blood pressure, and his blood pressure was super high. So sometimes if we don't have symptoms, it doesn't mean that we're not having any issues. And that's why it's important to monitor and see what's going on. Because I've seen a lot of cases where their immune system is weak and the patient is showing the symptoms or the signs in the mouth. So if you're starting to have some dry mouth, if you're starting to have more cavities, if you're starting to have inflammation, or the tongue is feeling that is like burning, then that is something that we need to be listening to, because the body keeps us sending us messages. So we want to make sure that we are listening to those messages and we're not ignoring them. We have a lot of cases where patients come and they say, no, I don't have any problems. Everything is fine. I haven't had any issues. And when we take an x-ray, the 3D image, because the x-rays that the conventional dentists take is usually the 2 image. But when we take the 3D image, we're taking the image of every single aspect, every single side of the teeth, and we're able to see the infections. So I've seen cases where the patient has zero pain, zero discomfort, and they have huge lesions in their bone. So it is important to take the CT scan to make sure that you are having the right comprehensive exam to be able to make sure that you're not going to have any issues down the road. So the magnesium that we recommend is the magnesium malate. And then you can start with about 100 times the body weight, and that will be the amount. For example, if you're 100 pounds, you will be taking like 500 milligrams of that per day. And then you can go and start working your way up to 3 grams per day. But again, talk to your doctor. Make sure that this is a good thing for you, because everybody is different. So these are just suggestions, but don't believe me. Talk to your doctor and see what works for you. We are all completely different, and what works for one person might not be ideal for another person. And that's something that we like to do with our patients. So if we're seeing you, we want to make sure that your doctor is also supporting you. We want to do this as a team. It's not just us. You have to be supported by your doctor. Ideally, it will be a naturopath or a functional medicine doctor, someone that knows the connection between the mouth and the whole body, the rest of the body. Do your mineral treatments help the teeth turn white? What do you refer to the mineral treatments? Maybe you can open your mic if you want.
When you talked earlier about doing, I think you said mineral treatments, do they also make the teeth white then at that time?
The remineralization
Yeah,
protocol,
that one.
the
Yes.
remineralization,
Yeah.
the treatment that we use to remineralize is a liquid, is a peptide that is going to help create like a scaffold on the tooth. Is usually to draw the minerals from your saliva to help remineralize, make that mineral, the lack of minerals, just attract that and then fill it up again with minerals to make it stronger. But that doesn't do whitening. This is just remineralizing that tooth structure. If, for example, you have a white lesion, some of those white lesions when there is incipient, and we apply the peptide, it might improve, but it's not made to whiten your teeth. Yeah, it's a little different. Mhm. For whitening, actually, we are doing something that I love the side effect of this product, and it is that it whitens your teeth. So it's called Perio Protect. This is designed, it's a special product that is like a mouth guard, but it is designed to help protect your gum tissue, prevent bigger problems. And it can be done for patients that are having periodontal disease, meaning that they're having problems with their gums and the bone. Or it can be used with patients that are having gingivitis, inflammation on the gums, or even for patients that don't have any of this but want to prevent. And what it does is that it it uses a gel, it's a hydrogen peroxide gel, and because it's custom made, this goes deep into the socket, into the sulcus, that space between the tooth and the gum. So if there is any bacteria in there, that's going to help address that bacteria. But the side effect of this product, of this hydrogen peroxide, is whitening. So it makes your teeth a little whiter and is safer than using a lot of whitening gels that are in the market.
Thank you.
Yes, you're welcome. A lot of the times we have some staining on the teeth that are from coffee, tea, some turmeric, sometimes some spices can cause this changes in the shade of the teeth. And when you go and have your hygiene appointment, with the hygiene appointment, a lot of those stains can come out if they're extrinsic, if they're just on the outside of on the tooth structure. Good. I think I addressed all the questions that are in the chat, and I don't know if anyone else have another question. And I'll encourage you to start
I have a
writing.
question.
Yes, Maria.
So I'm actually the one who emailed
Oh,
about my
okay, yes, your
15-year-old,
50, yes.
and she's with me, so I'm not sure how much I'll be able to say. But I caught part of the answer from Dr. Taylor. I'll have to re-listen to get the other part.
Okay.
I have 4 kiddos, and this little one is my youngest. So I did hear Dr. T talk about the mouth being opened. And my daughter usually has her lips sealed if she's like not talking or eating during the day. So I've been checking on that because I'm familiar with like myofunctional therapy. She does open her mouth during sleep sometimes. Sh- Uh, she's not breathing through her mouth, but just kind of relaxes her mouth and just opens it. But not too often. I can usually like hold her lips together and she keeps them that way. So I'm not sure what it's more of like gravity in the way that she's laying, or if there's anything that, if that's a concern that I should really look into it. But she's not
I
mouth
will,
breathing throughout
I
the
will.
day.
So Dr. Taylor mentioned when she was answering your question that a 15-month-old shouldn't have these type of lesions.
Yeah.
So there's a lot of things that need to be researched before coming into a conclusion that it might be mouth breathing. Because when we have a kid that is having already these lesions, we have to look into, as we mentioned, nutrition. We need to be looking into digestive issues that she might or might not have any symptom. So how is the microbiome in the mouth and the gut? So we have a digestive tube that starts in the mouth and ends in the gut. So that's something really important to look into. Our mouth, even if even if there is gravity, even if there is the muscles in the body is relaxed, we should not have our mouth open. Nobody, not even kids or adults. Because that's also part of, especially in kids, is part of the way we develop correctly. So if she's having a good posture for her tongue, then the lips should not be relaxed and open, right?
Well, I see that her lips sometimes come apart, but her tongue is still in the right place in the upper palate. And
Okay.
she did have a tongue tie release when she was a little baby.
The other thing that that is important to look is if she has any, like a lip tie, like that tissue that connects the upper lip with her gums, because sometimes the food gets accumulated in there if they have a lip tie. But if they already checked and they did the tongue tie, maybe they all evaluated that, but that's something to look into. So just it's difficult just without seeing the patient and without looking at in the mouth, because we see a lot of things in the mouth. We can see the bite, we can see the posture of the tongue, we can see the tissue, we can see if there is a little more dryness in the tissue, if we can see the bacteria, what kind of bacteria is in the mouth. Because if there is a lot of activity, that will give us an idea, okay, there is an imbalance in the microbiome, so we need to take that direction and see what it is that can be causing it. So it could be multifactorial too. There's a lot of different things that need to be kind of addressed or researched to be able to find out the root cause of why she's having this lesion.
Yeah. I kind of I came to my own conclusion, although it's not final, is the acidity. She just loved sour things since her teeth erupted, and it was springtime, would go on walks like 3 times a day, and she would look at all the wild berries, like the salmon berries, and then came the blackberries, and she would just want them, and a lot of them. And like, why does she want all the sour stuff? Or I'm like cutting a lemon for salad dressing, and she wants the lemon. And so I think maybe just a lot of that without us, giving her water afterwards, at least water.
Yeah, that could be a possibility. And then also a way to find out is maybe checking the pH in her mouth, getting those little pH strips, and anybody can do that. Just to check if your mouth is acidic. Of course, don't test her mouth right after she had the lemon, but just wait at least an hour or so after she eats, right? Or maybe before she eats, so you can test and see what's the pH. Because if she's having the lemon or the fruits and then within, like, I don't know, maybe an hour, and then she doesn't have anything afterwards, the body will have enough time to go back to the neutral pH. But if an hour later, 2 hours later, she's exposing the teeth again to another thing that is acidic, then that's the repetition that's what causes problems. But you can check the pH. One of the things that I recommend is, for example, and this is an experiment that you can do, for example, at night before going to bed, test the pH in your mouth or test the pH of your daughter. And then if, let's say it's around 7, in which this is what we want, and then just when she wakes up or when whoever is doing the test wakes up, test the first thing in the morning before eating anything, before rinsing your mouth, test the pH. If those numbers, for example, between the night and the morning changed and then became acidic, something is happening at night. Could be that maybe the mouth breathing is causing some of the acidity, is changing the
Mhm.
pH. It could be that there is some acid reflux that is happening,
Mhm.
and we're not aware of that. And a lot of patients actually are not aware of acid reflux until it's too late.
Mhm.
So it started causing the really discomfort and the symptoms. So those are things that are important to take into consideration. And maybe during the day, half day, like even if she's not, like she hasn't had anything to eat, just test the pH and see what it is. Let's
Mhm.
just have a little more data to go back to find out what is the cause of this.
Mhm. So what's a good time between meals or snacks to allow the saliva to remineralize?
It's always a good time. So it's not like a specific time during the day that the saliva helps remineralize. The
Okay.
saliva naturally has minerals in it. But of course, we have to be giving the body the right nutrition, right? If you're feeding or if you're eating a lot of carbohydrates, if you're deficient in certain minerals, if you're not having the right like vegetables and you're not having some supplements like mineral supplements, and kids mainly you want to have what I mentioned of the supplements or the foods that we want them to start having, the cod liver oil, the eating good vegetables, greens, fats, animal protein, even though we have to be careful with the greens because there's quite a bit of oxalates in some of those. So good fat, animal protein will be a good idea. Grass-fed, like dairy products, eggs, fish, all those are really good for our body. And the minerals that we get from that, that's what the saliva is going to provide the teeth. And when the saliva is bathing the teeth with it, it's just the teeth are moist, then that's what is going to give the remineralization. And that's why a lot of people that start having dry mouth, or for example, a lot of patients that are taking a lot of medicine, they start having some dry mouth, then there is a higher risk of cavities because that saliva is not bathing the teeth. It's not remineralizing and keeping the teeth remineralized. So
Mm-hmm.
that's the important part of
Mm-hmm.
the saliva.
And Dr. T mentioned that one of the options for treatment at home would be iodine. Is it just plain iodine, or is there a specific type, brand?
I believe it's just the regular iodine, but honestly, I have not done that, and so that will be a good question for her.
Mm-hmm. Mm-hmm.
You could email the office, info@Green City Dental and say, oh, what kind of iodine? I'm almost positive that is any kind of iodine.
Mm-hmm.
And then
Mm-hmm.
remember, is just a temporary solution. Maybe works, maybe doesn't. It's just like the silver diamine fluoride. It kind of puts a stop on the growth of the bacteria or the cavity.
Mm-hmm.
So it doesn't take it away,
Yeah,
but it
yeah.
can stop it. Mhm.
So is decay like this in a little baby, is it always caused by bacteria, or could it be just say acid? Or is bacteria always a component of decay?
Yes, there's always a component of decay
Mm-hmm.
because you can have demineralization and you can have like white lesions because of
Mm-hmm.
acidity, but those white lesions doesn't necessarily turn into cavities.
Mm, okay. Okay.
Mhm. So there is a specific bacteria, it's called Streptococcus mutans. That's the one usually kind of that causes the cavities.
Mm-hmm. Mm-hmm.
Mm-hmm.
Because with my daughter, it started out with those white spots.
Mm-hmm. Yes, and
Just kind
that's
of quickly progressed to
correct.
like.
It's just it makes it easier for bacteria to stick to those surfaces that are not as smooth and they're softer. So it's just perfect environment for bacteria to hide and to
Mhm.
cause the damage. Because as Dr. Taylor said, like they eat the food and they poop acid. The bacteria does that. So it creates even more wear, more destroys the tooth structure,
Mm-hmm.
creating the softness of the decay.
Mm-hmm. Mm-hmm.
Yeah.
And as far as getting rid of bacteria in a little one like that, what are some options?
We do not want to get rid of all the bacteria, and that's one of the
The
things that
bad bacteria.
we want to create a balanced environment.
Mm-hmm.
So there is definitely having a really good oral hygiene, finding the root cause of the problem. Because I can give you a lot of recommendations, but that might not be the reason for why your daughter is having these cavities. So looking at the bacteria, looking at just taking a sample of the plaque, or maybe even doing a test where we can find out exactly what kind of bacteria is in her mouth. Checking the pH, making sure that you're feeding her the right foods, all the things that we just mentioned. Just keeping the mouth completely nice and clean. Brushing, it is important to do brushing. If her teeth are together, flossing, just at least minimum of 2 times a day, brushing.
Mm-hmm.
Because otherwise that bacteria, the plaque is going to be accumulating, and that plaque is full of bacteria.
Mm-hmm. Mm-hmm.
But looking at the root cause, just finding out exactly what's causing that.
Mm-hmm. Okay.
And at the same time following all these recommendations that I just mentioned.
Mm-hmm. Okay.
Well, thank you everybody for coming to
Thank
the
you.
end. And we'll see you guys in a month where we're
Thank
going
you
to
very
do the.
much.
You're welcome. Have a great evening, everybody. Bye.
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 Thank you so much. Bye.